So welcome to HiNZ 2017, and we're talking with Richard Medlicott. And Richard addressed the audience at the conference yesterday on the patient portal.
Yeah.
GP. So, Richard, tell us about it.
Well, so it was a pretty good news story, I thought, although with a lot of these things, sometimes it's half glass full and sometimes half glass empty. My major point to make about patient portals is that we've got 53% of practices in the country signed up for it, which is great, but we've only got 11% of patients signed up. So some practices are doing great, 30, 40%, but many are hovering at the 5, 6, 7% of patients being signed up. So kind of looked at that and why that might be the case and what we could do to help and so on.
And when you talk about patients being signed up, because through my GP practice in medical centers, so I now make appointments through it, and recently I saw the lab results were there. So by just using it, am I signed up?
You are signed up.
Right.
So
okay.
And one of the things we tried to get practices to do is to think about an all-of-practice process for this. So when you're starting, there might be one or two champions who are just kind of, putting their toe in the water a little bit to check the temperature. But once the decision is made to push it out wider, then get everyone involved: the receptionists, the practice nurses, the managerial staff, the other doctors, and encourage patients to fill out the form and check their email and fill out what they need to do online.
Mm-hmm. Now, is there the number of functionalities in the patient portal? So it doesn't all come online all at once. So what is the typical pattern that the practices are using and implementing it?
Sure. I guess there are two main ways to approach it. One is whether you go full open notes, and I'll explain the open notes in a moment, or you have it relatively limited. So certainly everyone will be switching on electronic prescribing and the appointment book, and then I'm sure most would be letting you have a look at your lab results and your blood pressure and so on and so forth, and your medications and allergies. Where the question arises is whether you're going to switch on the stuff that we write about you, and that's called open notes. And there's a lot of evidence from around the world and in New Zealand that open notes really engages patients. It helps build trust and autonomy. We didn't go open notes initially, but we've been doing it for about a year or so, and patients really like it. Mm-hmm.
Yeah, I've seen actually my own practice has recently launched that, and I did see that. And
did you find it interesting to have a look?
I did.
And to go back and
did
see
actually.
What you thought of the consult?
I did find it interesting, and I found that there were, because I had to go see a couple of different doctors. I couldn't see my own, and it was interesting to see the different styles of the notes. Of course,
the young doctors are great note writers, I feel, but mine aren't quite as good.
So is that part of that hurdle to overcome in the uptake in the practices itself? Is changing the behavior of the GPs?
I think we're really encouraging open notes, but if they're a bit anxious about it, perhaps don't switch it on, that part of it first up. So I think it's a bit broader in terms of the uptake. I think there's kind of, you've gone through a process to set it up, but then you need to follow it through with the process for making sure it's kind of slick at the front desk, for getting them to give the paperwork and to sign them up in the PMS. And it is coming back to that all of practice approach, really, of everyone singing from the same tune, that you don't have one doctor who's a bit anti and another one who's pro, because then your patients get confused and it never really takes off.
And how do we actually, because there's the patient side of it, and people say, well, if consumers demand it, it will happen. And I'm not so sure that will work in some cases, where if there's a resistance perhaps in medical practice, or a perception that it's more work in either answering emails and so on. So how are you addressing that side of it?
So I've done a number of talks at different forums on patient portals, and that work aspect is really critical, and it is a worry for people. What we found is that it does increase stuff coming into the inbox, but in fact it's it's meaning you're not having to phone people, and you're saving it in terms of other things, in terms of lab results and so on. And if someone does have a query that's come through, very often it's related to a recent consultation, which might have been a "can you please phone Pat back about X, Y or Z?" And they send you a message, which is usually pretty short, and you can answer it pretty quickly. It goes into your system, so there's no more double handling of the messages. So that kind of saves us time, really. And certainly electronic appointment making and repeat script ordering and so on, and not having to phone normal results is a big time saver.
And so what would be the targets, because I think generally the uptake has been perhaps slower than what was initially the initial goal. So what are the targets now, let's say in the next 12 months?
Yeah, I'm not sure, to tell you the truth, what the Ministry of Health targets are. I know that in our PHO we're looking at trying to get the healthcare home practices up to 40%, which is quite a lot. That's not easy. But going back to this half glass full thing I touched on earlier on, I was sitting next door to Judy Eves from the Ministry of Health on the flight up, and she had hot off the press data, and I had to update my PowerPoint from 8% of the population to 11% of the population. And that, I think, is in the last 4 months or so. So every 3 or 4 months we're getting another 60,000 people on it. And I think it's going to accelerate. A year or two ago you'd get 5,000 in 3 months, so it's really starting to increase.
And are there certain types of practices in certain demographic areas that are more receptive to it, or more quicker in the uptake than others? Has it worked that way?
It seems all but 3 PHOs have got at least one practice who are using the portal. Within PHOs, it's probably an average of, well, I guess 50% on average have signed up. I'm not aware of any particular geographical or socio-economic clustering of this. I mean, there may be. I do know that within our own practice, older people use it more because they've accumulated more health issues. We know that smartphone penetration in New Zealand is really high, including in lower socio-economic groups, and for those groups actually being able to do interaction with your doctor and not having to pay up at the front desk can be a really helpful thing. So, it'd be nice to see some changes in the funding models to support this a little bit more, but we'll see what happens.
I was talking to one of the GPs at the function last night, and in terms of behavior change, one of the things that certainly I'm, and a couple of friends of mine are more conscious of, if we're booking an appointment with the GP, if you go into the portal, now it'll say if you have more to discuss with the doctor, then we recommend booking a double appointment. And sure enough, I've started to do that. If there's a few things that I really want, that's fine with me. I book it.
We need more patients like you.
Yes, so it's been a behavioral change thing that in encouraging people to do that rather than just what was the standard thing.
And that's people reacting to information, isn't it? You get the information at a time and place that's convenient for you to respond to that information.
So has there been any experience in that as to how it's changed the flow of patients in a typical appointment day?
Yeah, there was a study that I think Separe did about a year or a year and a half ago, looking at it, and it found perhaps a slight increase in GP time. I wasn't totally convinced, but certainly decreased time at reception and nurses. What it allows us to do, I know, is that we've got quite a high patient to doctor ratio. By managing things non-face-to-face efficiently, not having to bring people in for appointments, we can fill the appointments with people who do need to be seen, but we also have quite a high capitated population, which is good for the bottom line. I mean, that's how you earn money.
And so one last thing in terms of the telehealth, because that's obviously one of the areas I'm working in. Is there anything planned for in Manage My Health? Functionality,
I hear we've got video coming up very soon.
Is that right?
Yeah, so that'll be really interesting, and I'd be quite keen on being an early adopter of doing video consultations through the system. So I think they're going to be switching it on for patients with just using their smartphone, because you know that the camera's going to work, you know the microphone's going to work. At the GP end, either using web or the app, which you can download.
That's exciting, Richard.
Yeah,
so we'll look
wonderful.
forward to hearing
Indeed.
you presenting next year
Yeah,
on how
and how the
the
video's
uptake
gone.
of video has
Sure.
gone with the patient portal. Thank you very much.
Lovely, great.
Thank
Thanks,
you.
Pat.
Thank you.